Hello, this is cystic fibrosis.
And today we're going to go over cystic fibrosis and understand the cause and effect of the disease and how it can be treated. Cystic fibrosis is an inherited, life-threatening disorder that damages the lungs and the digestive system. Carriers of cystic fibrosis can pass a copy of the CFTR gene mutation to their children. If both parents carry the mutation, there will be a 25% chance their offspring will happen to have cystic fibrosis. There is also a 50% chance that offspring will be a carrier of the cystic fibrosis gene mutation.
This condition is inherited in an autosomal recessive pattern, which means both copies of the gene in each cell have a mutation. Cystic fibrosis is caused by mutations in the gene that produces the cystic fibrosis transmembrane conductance reticular, best known as CFTR protein. The gene that causes problems in CF is found on the 7th chromosome. The most common gene mutation is called delta F508.
Symptoms of cystic fibrosis.
The classic form involves characteristic findings in the respiratory tract, gastrointestinal tract, male reproductive tract, and sweat glands, and is caused by loss of function mutations in cystic fibrosis transmembrane conductance reticular CFTR gene.
Most people are diagnosed with cystic fibrosis at birth or before the age of 2. Symptoms of cystic fibrosis are salty tasting skin, persistent coughing with phlegm, wheezing and shortness of breath, stunted growth and weight gain, bowel movement difficulties. How is cystic fibrosis diagnosed? Most people are diagnosed with CF during the newborn screening. Doctors will confirm the diagnosis with a sweat test or a genetic test. What is a sweat test? A sweat test measures the amount of chloride in sweat.
How is function disrupted by mutations? The functions can be disrupted by the mutation distributing the productions of protein found in all the cells all over the body. How the disrupted functioning lead to symptom of disease? Cystitis causes protein to non-function and makes it build up thick mucus.
There are close to 40,000 children and adults living with cystic fibrosis in the United States. Approximately 1,000 new cases of CF are diagnosed each year. More than 75%.
Fibrosis. Information about cystic fibrosis. Normal functions of organelle. Helps maintain the balance between salt and water and main surface in the body like the lungs. Lifespan. Most people live up to 70 and 80 in their lives, but with this disease, it gets shortened by a lot, and most people with the disease live up to 44 years old.
Treatment for cystic fibrosis. Treatment depends on the severity of the case. Sodium chloride can be ingested or injected into the body to treat low sodium levels. Medications like antibiotics and cough medicines can aid with cystic fibrosis. Also, a procedure called chest wall oscillation can help with the removal of mucus in the lungs. Unfortunately, there is no cure for cystic fibrosis.
In most kids with cystic fibrosis, says Belch, the CFTR protein gets stuck inside cells in the cell organelle known as the endoplasmic reticulum, a convoluted membrane sac within the cell where the synthesis of proteins like CFTR and other vital cell functions take place.